Stephen, when you put coffee in a large cup like this is all about the coffee cup is just not big enough for the desire of the person on any given day.
They definitely make big coffee cups.
They do, but for whatever reason, I grabbed this. So I'm Billy Hoffman, and this is Stephen Smith. And you may remember that we've been going through this whole series on adult children of alcoholics. And the thought I had for today is we've gone through the laundry list traits. Like in the real world, in practice, and as some of you don't know this about Stephen yet, but he is an EMDR specialist, okay? So he knows a lot about EMDR, and my question would be, if I'm the patient, okay, and I come to you, and I have so many of these things on the, ACA laundry list, how does the EMDR process start? Where do we go with this stuff?
Sure. Yeah. So, well, one, thanks for asking. And two, EMDR, I mean, you can imagine, because I'm trained in it, it's something that I believe in pretty strongly. I don't know how many podcasts ago we talked about finding a sort of ACA-informed therapist for people who are in recovery. If you're someone who resonates with this, any kind of trauma specialist, of which EMDR is a type of therapy, I would think is probably going to be ACA-informed, because we're going to be treating and looking at helping people process and work through some of the things, memories, experiences that happened in their life that kind of spawned the laundry list traits. That's essentially what we're going to be doing. So EMDR is a pretty comprehensive model. I'm going to do my best to kind of simplify it.
And some of these memories are memories that I might not be aware of. That somehow the process of EMDR can go deep inside my brain and pull these things up.
Yes, I don't know if it's quite that. I'm not doing anything super special as an EMDR therapist that's pulling them out. It's more about the types of things we're getting people to think about, talk about, and the eye movements or the bilateral stimulation, which I can talk about in a second, seems to help the brain, we'll say, make more connections. And so often the brain can sort of retrieve memories that are in there, but just, people can't immediately think of. Pretty much everyone has had the experience at some point in their life of having it like, oh, something's on the tip of my tongue. I know that I know this, but I just can't remember it. And then eventually we remember it. So EMDR just seems to kind of help sort of make that process a little easier. But I don't like to think of it like I'm fabricating or pulling out memories. These are things that people usually just recall. Maybe when I share more detail, it'll make a little more sense about what I mean by that. So what I would say is people, are thinking, oh, maybe I want to, process this stuff a little more. I'm interested in EMDR. What it probably would look like is, you're going to go into your therapist and they're probably going to ask you one of two things. If they're an EMDR therapist, they're either going to take a look at, maybe you come in and you already know there are specific incidents in my life and my childhood that I have now recalled as a part of maybe my 4th-step work or my other just therapy, and I want to reprocess these. So sometimes people come in saying, I had this happen with my dad when I was 8, and it's stayed with me ever since. Other times they come into therapy and they're going to say, I have all these problems in my current life, many of which are on the laundry list. Like, they're probably going to say, I don't know, I hate conflict. I'm always walking on eggshells around people. I'm a people pleaser, an approval seeker, and I want to change that. What we're going to do in that case is we're going to say, okay, tell me a little bit more about how that shows up in your life. What are the present examples of those laundry list behaviors? And then we're going to start to work our way back. I'm going to ask people to identify where they learned some of this stuff. I'm going to ask them to think about times in their life where they felt that way. And I'm going to begin to help them identify memories that may connect to the current laundry list traits. That's sort of phase one. And ultimately what EMDR is going to do is once we identify all those different memories, of which there can be a bunch, we're going to pick one that we think is going to be the target memory, and we're going to start with doing some reprocessing around that memory. And as we do that, typically people are going to see if EMDR is successful, a lot of the underlying emotions and the behaviors that they may be wanting to change get a little easier to change.
So, pardon my language, but just from a man on the street perspective. So let's say I'll just call it primary memory. I don't know the language that you use for this. Let's say I have a primary memory, and what I want to do, and it's come up all my life, but only this portion of it, right? Will EMDR help me discover things that were around that memory? So, one of the big ones in my life was something that happened with my father in a Pizza Hut. Okay, so would your help get me past just the screaming about the waitress and what ended up happening there, but also a lot of the other stuff, the ride home, might it help with that?
I definitely could. I don't want to say 100% yes or no, but I can say, I mean, it is a common occurrence in EMDR reprocessing sessions that when we're doing some of the eye movements, that people will be doing the eye movements. We're going to pause. I'm going to ask them what they're noticing or what's coming up for them. And they may say, I'm now remembering a part of this memory that I hadn't really remembered. This was this other part of the scene. And then we'll keep going. And people realize that I had forgotten entirely about that. So that has happened in many of my sessions. So
as two people that work for Williamsville Wellness, we have made a big assumption here. EMDR, what does it mean?
Great question. EMDR stands for eye movement and desensitization and reprocessing therapy. Okay. You can see why they shortened it to the acronym. It's a mouthful. The eye movement, the EM, comes from the part of the reprocessing therapy. So once we've identified, let's just say this primary memory, in EMDR, we would call that the target memory, the thing we're going to help this person reprocess. What we're going to do is I'm going to ask them a series of questions to bring up the memory. I'm going to ask them about feelings they had at the time, and I'm going to ask them to identify what negative beliefs that they had about themselves as a result of that memory, because those are often a big impact of these memories. And then we're going to start eye movements. Typically, that's done. You can have someone, they follow a hand. Some people will have like a computer or technology that has like a dot that you can follow. There's lots of ways you can do it. And people basically think about and focus on the memory we're reprocessing while they're moving their eyes back and forth. We'll do that for 45 seconds to a minute-ish. We pause, and then I'm going to ask the person, okay, just what are you noticing? I'm asking them to just let their mind notice, experience whatever comes up. And people are going to briefly, in between those sets, tell me parts of the memory they noticed. They might tell me thoughts they're having. They might tell me emotions that they're having, physical body sensations. The brain is basically doing its own healing in that moment. It's kind of working through all the different parts of the memory. Some of that can be negative, difficult, distressing things that are going to come up. But ultimately, the more that we do it with EMDR, and as your therapist guides you through it, it helps people sift through some of the negative stuff and find more adaptive, helpful, useful, positive stuff out of the memory. And then often, I'll say in a successful sense, however long that course of EMDR takes, a successful version that usually looks like the person at the end saying, the memory that we started processing is no longer as disturbing as it once was for me. It doesn't have a lot of distress. They might even have gained some insights. They might have some more, they'll say something like, well, when I look back on the memory now, I realized that it actually taught me X, Y, and Z, and I actually developed something useful from it, even though it was a really challenging experience.
So are we saying then that, we always talk about the things that we're thinking, right? If I focus in on some of these distressing memories, and they make me feel a certain way, are we saying that EMDR is able to get to the things that are more subconscious that could be going on in the background, perhaps since we were kids, that are causing issues that if we can get to them, it will help us.
Yeah, it's endlessly. Yeah, I think that is kind of what EMDR does. The unique and part about EMDR that I think, or one of the unique things about it, is that a lot of that process doesn't actually require a ton of talking, which I think makes it its own really unique thing. So other forms of trauma-focused therapy, some of which have evidence-based too, these are equally good techniques, rely a lot more on talking and having people tell the full story and talk through parts of the trauma. But when we're doing the eye movements and the reprocessing, people are going to just be very brief in what they're reporting to me, but they're going to be thinking, they're going to be experiencing a lot internally. They don't even have to tell me about every piece of it, but they still might discover some of those unconscious things.
Stephen, are you telling me that someone that might be more treatment resistant could possibly benefit by, through EMDR, in that, you don't have to worry about all the talking, which a treatment resistant person is not going to talk.
Mm-hmm. Yeah, I think that is one of the draws to it. There are many people who think about or consider trying EMDR who maybe have done a lot of talk therapy and have just sort of felt like it didn't really take them anywhere. And then there are other people who hate talking therapy and don't want to do it all that much. And so that aspect of EMDR can be more appealing, and it definitely can be more helpful to those people.
Yeah. And if you don't like talking in therapy and you're with a therapist who isn't going to talk that much, it's going to be a long session. It's a long session, yeah. Stephen.
It definitely can be.
Okay, so tell me about that. So, I've seen some people use the paddles. You get some that do all this stuff. How many different versions of that are there?
So the most common, at least so as I was taught by the EMDR Institute, the research shows, generally speaking, that the best results come from the eye movements, back and forth. And the most common, the way they teach you that is sort of nuts and bolts. To have the therapist sit kind of off to the side and they have you move your hand and they just follow the fingers. Plenty of people will use like a longer like wand or something that's easier for the person to follow without therapists having to sit super close. I have to mention the light bar where people will have like a screen or something that has a dot. So the eye movements are generally, I'd say, the most common version of the bilateral stimulation. The paddles that I think you're referencing, we call that tactile bilateral stimulation. So these are usually two vibrating paddles that people will hold, and they'll vibrate left, right, left, right, left, right as the person is thinking about the memory. So those exist. And there's even also auditory, so hearing-based bilateral stimulation, where people will have either like earbuds, headphones. If they're doing it virtually, they'll have like a tone that'll go left, right, left.
Like a binaural beat.
Yes, exactly. Yeah. And again, what to tell people out there that if people have heard of binaural beats, just listening to those on your own is not going to treat your trauma. Mm-hmm. You do those in conjunction with all the other stuff that a therapist does with you in the room. So yeah, there's visual, there's tactile, and there's auditory are the three main ways that people do the bilateral stimulation. The tactile and auditory both have research supporting their effectiveness as well. It's just shown that the eye movements slightly outperform those. So generally, that's what we start with.
So those who are watching this right now, they're now interested in what EMDR is. What would you tell them to do next?
Yeah, so if you are interested in EMDR, probably two resources that I give to a lot of the clients that might be doing it with me. One is just to go to the EMDR Institute's website. You could just Google EMDR Institute. It'll take you right there. They've got a FAQs, frequently asked questions section, and it even says like prospective patients or someone considering EMDR. They give a really brief, very accessible kind of page read about what is EMDR, what can you expect. And then if you also go to YouTube, there's lots of really good short videos about EMDR. One that I'll often send to clients was made by the VA. And it's like a 3-minute video that just explains in a little more detail, step by step, than I did today, what you can expect from an EMDR session in phase 1, an EMDR session in phase 2, so people have a little more concrete information to go off of. That's how you can learn a little more about this process other than just what I've shared today. If you're also interested in it, I'd say, consider talking to either your current therapist about it or go do some research for therapists in your area. Look for someone who is trained in EMDR or is EMDR certified. Both of those things are good. That means this person's going to be fully licensed to be able to do that work with it.
Well, adult children of alcoholics and EMDR, just a few of the things that you'll find on the Williamsville Wellness podcast and also at Williamsville Wellness. We'll see you next time.